Welcome back to another episode of Dentistry's Growing with Grace podcast. Join Grace and her guest of the week as they discuss lessons learned in the industry and explore unique insights into ethical growth.
Hello and welcome back to Dentistry's Growing with Grace. I am so blessed and honored to have my good friend Rachel Wall here with me today. Rachel, thank you so much for joining us.
Absolutely. Thanks for inviting me, Grace.
Of course. So I've been wanting to have you on the show since before it was even a show. So I'm so glad you're here. I know you personally and professionally a little bit, and you're someone that I really look up to in business just because you've always been such a positive force for the industry and such an example of integrity for the people around you. Tell us a little bit about your journey to where you are in business right now and kind of what brought you to the place that you're at in business.
All right. So it's a long story, but I'll keep it short but sweet. So I'm a hygienist. I've been a hygienist. I graduated from hygiene school in 1991. So next year will be 30 years, which is like, kind of blows my mind. And kind of just accidentally got into hygiene because I was going to community college and my mom said, you need a direction. And that direction could either be, move out, get a job, or stay here and start paying rent, or you need to be working on some kind of degree that's going to create a career for you. And so I happened to have a hygiene appointment and the rest is history. So, I have that hygienist, Sally Boone. I've lost track of her, but somewhere she's going to show up one day, but I have her to thank for all of that. And then worked as a hygienist in some amazing practices. I started in a very small town practice in Southern Virginia. That was pretty old school, but I learned a ton and worked with some great people. And then I decided to go back to school at UNC and worked in a phenomenal practice there, all female practice. That's where I discovered practice management. And I was exposed to my first dental coach and consultant. Actually, the first coach that I was really exposed to in that practice was Deborah Englehart Nash, which is a trip because now, she's actually lives like a couple blocks from me. And so it was really cool. And I just kind of got a sense that there was more even than clinical hygiene that I wanted to do in dentistry. And so actually I applied to dental school 3 years and didn't get in. And actually went and worked at the dental faculty practice at UNC in the perio department, which was another great experience. I learned a ton. And I thought, okay, these people are going to know me. They're going to love me. They're going to write me a letter of recommendation. And I'm in, like, this is it. And guess what? I got the letters of recommendation, but I just didn't make the cut. And that was really hard. And I had a good friend at the time who was really struggling with something personally. And she looked at me and she's like, you know what? Life's too short to be miserable. You are really struggling with this. Why don't you just take a year and look and see what else is out there for you? And that's really where it all started. And so I've had some incredible mentors that I'm so grateful for. And I started Inspired Hygiene about 15 years ago. And here we are. Yeah.
Awesome.
That's the story in a nutshell.
It's awesome. It's challenging for us sometimes to trust God's plan for our life. We think we're in control and we want to be in control, and then his
not.
blessings are sometimes greater.
Yeah.
So, oh my goodness, I love this first question. We've had so many changes in dentistry, and we're just for anyone, we're going to say where we're at. It's early September. I keep losing a month. It's early September. I can't fast forward this year.
Trying to get through the year, right?
It's early September right now as we're recording. The last 6 months have been inconceivable. Tell me what's different now about coaching a hygiene team than it was 6 months ago or more.
Yeah, there's a lot different. I think the hygienists are really struggling, or at least what I'm observing, with everything that you and I are struggling with too, right? Whether it's kids that did not have the opportunity to go back to school, whether it is uncertainty with a spouse or partner's job, whether it is some fear going back into clinical, whether it is not completely confident in maybe the infection prevention, processes that are in the office, whatever it might be. There's just a lot of stress on everybody right now. And we're seeing that. We're seeing that show up big time with hygienists. And also, the lack of, or I'm going to say the high volume of patients that came back in. And so the lack of much time to really prepare for our days as hygienists, to get notes done, to think about, our patients in a bigger sense, is all of a sudden, I think when this big influx came, what we've seen a lot of is that hygienists were like thrust into what I'm calling this dark prohpy tunnel of, let's just get everybody in as fast as we can. We're going to work through this, but there are some consequences to that. And, none of us knew how to work through a pandemic. So there's no judgment, right, on how everybody handled it, but that's kind of what we're seeing. And so where a lot of dentists and practice owners were able to kind of have hygiene on autopilot, whether it was performing at the level they wanted to or not, that's another thing that we hear from a lot of our clients is like, I've just kind of had hygiene running in the background, and it's been okay, but I know it's time that we really pay some attention there and really take it to the next level. We can't run it on autopilot anymore. Yeah.
It sounds like too, we're dealing with, for lack of a better word, I'll say fluffy issues. We're dealing with emotional challenges that are very real, but they're less tangible than the physical challenges that we're used to facing in the profession. And it seems like coaching a hygiene team now versus 6 months ago, it sounds like you're saying it's going to require a little bit more. In a sense of emotional support, morale, focus on morale, connectedness as a team, in order to push through and get through those high volume catch up, days when you're still working with fear and uncertainty and all these other psychological stressors.
Yeah.
So.
And I mean, the fact is that none of us, I mean, you and I run a business too, right? And we can't run our business on autopilot right now either. Like, we're having to pay attention to everything, right? Everything from looking at the P&L on a much more frequent basis maybe than we did before, to, making sure our teams feel appreciated and supported, and figuring out, for us, okay, so what do we do with all these flights that we had booked and they're now canceled? And, are we going to use those in the future too? How do we help our teams and the hygienists on the teams that we coach, help them get back that patient-centered, positive mindset? And it's a challenge. And so I kind of developed this process that we're going to start working with our clients on, and I'm going to start getting this message out is, for dentists, it's accountability, acknowledgement, and then just activating that patient-centered focus again, that core value of patient care. And I think those are some good places for practice owners to start with regards to how to kind of lead back into a positive place with the hygiene department.
Mm-hmm. Absolutely. So how can dentists identify hygiene systems that have broken down?
Yeah. So when hygienists got thrust into this prohpy tunnel, even some of those that we've coached, that had a very clear perio program in place, or they were used to taking in, intro photos and preparing the patient for the doctor's diagnosis of restorative or whatever it might be. Some teams just said, okay, let's get more patients in a shorter period of time. And then what gets left out are those diagnostics. Like over and over, we see that happen is when hygiene appointment times are shortened, the first thing to go are the diagnostics. And that is what's going to be serving your patients and your practice going forward. So it's super critical. So I think a couple things just to look for is review your standards, right? This is a little piece of that accountability too, is what are your clinical diagnostic standards? And what are your clinical care standards? So for example, how often are your hygienists doing a complete perio charting? Is that happening right now? And
okay, yeah. So you're advising that they go back to the basics despite being frazzled and stressed and sometimes fearful. You're advising that they focus on those core basic things that have kind of, I've seen in so many businesses, not even just in dentistry, that we kind of go, oh, well, because it's the pandemic, we don't have to do these 10 things anymore right now.
That's right.
And we've
Right.
kind of went into like emergency, like bare
Yes.
minimum mode.
Yeah.
And
Well, it's kind of like flight or fight, you know?
Yeah. Yeah. And how do we get out of bare minimum mode and go
Mhm.
back to those core fundamental pieces of the business that are so crucial? And you said this, you said not only for the business that it's going to feed your business, but it's going to serve your patients.
Mhm.
How important is that? How important is that when it comes to being our focus?
Mhm. Number one. And so here's what I would suggest is, you know, if all we have as a leader is accountability, then our team's going to get burnout, right? So we've got to match that accountability with acknowledgement and appreciation too. And honestly, I think the appreciation needs to come first. So first, you know, take some time, you know, even in this crazy time, and a lot of teams I'm seeing too are like, okay, we're going to take time off, but we're going to wait till October. Well, you might not have a team in October if you wait that long, honestly. So maybe block out an afternoon, bring in lunch. If you got to do it outside or do it in somebody's backyard to, you know, so that everybody's comfortable with social distancing, fine. But bring in lunch, have some fun time together. Just go around the group and just say, hey, what are we grateful for right now with our team? And then say, here's what I would like to do is I just want to go back to the basics and to some of our agreements, right, around our standards of care. And I know there's a lot of stuff there's a lot of noise. There's a lot of stuff that's going on in our practice right now that we didn't have before. And yet our core value of providing, you know, whatever your core value is in your practice with regards to patient care, well, I would say just review your core values across the board. And then if you want to take this piece, take this particular piece and say, let's go back to our standards of care. And we've got a great document on our website. It's inspiredhygiene.com/standard of care. And there's a worksheet there that might just be a starting point. You can modify it any way you want. But look at that and say, okay, so are we getting this done? Like, let's be honest, no judgment. This is a safe time to kind of work through this. Are we actually doing this on a regular basis with our patients, right? Are we doing our medical histories? Are we doing our perio charting? Are we taking intro photos? And figure out what are the pieces that has fallen out, because dentists, you're going to see this when you're going in to do your hygiene exams, right? So there's not photos up and we're, you know, just kind of trying to get through that exam. So look at that, look and see, is there a current perio chart for the last year? Maybe you say, hey guys, can you just print me out for the next week on every patient, print me out the most current perio chart and have it ready when we come in to do the exam. That alone will encourage the hygienist to say, oh my gosh, it's been a year and a half. All right, we got to do this. And then now they're going to have a current perio chart for you to look at, and you can look together and see, you know, all right, is this a patient that was always healthy? And, you know, maybe they have a couple areas of bleeding because they missed their hygiene appointment and we're going to get them back in sooner. Or is this a patient that was always bleeding and it's time to move them into another level of care?
Yeah.
So just some kind of practical ways of identifying some of those things.
I love it. Such great, tangible, applicable advice that people can take and put into practice right now. And if you haven't reconnected with your team, if you haven't shown that appreciation, make it a priority no matter how busy you are. I think what the pandemic has done to a lot of people is it's made us play the short game. And we can't play the short game. We have to play the long game.
Yeah.
If you're playing the short game, just trying to focus on cash and profits, and you're not focused on your team and how you're going to build long term, you're for a lack of a better phrase, you're going to shoot yourself in the foot. Mm-hmm. So take a step back, gain your composure, gain your positivity, and then play the long game and implement the things Rachel's saying. So thank you so much for that. So Rachel, my next question is, how can dentists help hygienists escape this dark prohpy tunnel that you speak about?
Yeah. So I think the first step is establishing what are our standards of care. And certainly if you don't have a clear perio protocol, that's right up our alley, right? We love to to help folks with that. We do that with in-office coaching, but we also just released the new update of our Profitable Perio online bootcamp. So little plug for that.
There you go.
periobootcamp.com. And it just walk through with your team and really establish that. So I think that is kind of the default, right? So when we're rushing, I'm trying to think of a great analogy, and I'm not real sharp with those today.
I love analogies.
I know, but I'm trying to think of like what our default is. Okay, so let's say you've had a busy week and you're used to preparing really healthy meals for your family. Like, you know, my default is the DiGiorno pizza in the salad, right? That's my default. Is it the best thing for us? No. Does it get us past dinner with little effort? Yeah, it does. So like maybe think about your prohpy as your DiGiorno pizza, right? So it's kind of corny, but it's just what kind of came to my head.
I love it. Go with it.
But think about that as like, we're under stress. Time may be shortened. You might be running behind from the last patient. So our default is like, okay, I just got to get this patient's teeth cleaned, right? Because that's what they're expecting, right? I just got to get these people fed because that's what they're expecting. So we do that. And then one day turns into the next, and then that turns into weeks. And then it just has become, we've slipped back into that, what we call the prohpy trap. But it's even more than that. It's become this dark tunnel now where there's so many other emotions and fears and stress and burnout like coming up to the surface right now. So support your team in saying, look, like this isn't, my expectation is not that we're going to go from, you know, doing a perio chart on every patient, you know, every 2 or 3 years to doing it every time. Like we just got to start with one thing.
Yes.
So
we're not going to go from DiGiorno to 6 course.
That's right.
You know, chef prepared.
Yeah.
But we are going to start maybe putting chicken on the pizza, like a grilled organic chicken on the pizza. Yes.
Right. We might put some vegetables on the cheese pizza, right? Or we might add a salad with some good vegetables or something like that. And then, so yeah, exactly. So I would say go through and, you know, establish the standards first, and then walk through a couple days of patients together. And the hygienists know, they're like, yeah, this is the person that bleeds every time. And I keep telling them to floss and it's not working. All right, well, something else is going on here, right? And we've got to identify that. And it's in the patient's best interest to move from a prohpy into some type of more comprehensive care. So let's identify who those patients are and say, all right, these are the 3 that I'm going to tackle today. And I'm going to make sure I get a complete perio charting on this patient. And if they exhibit signs of active infection, we're going to present perio, and dentist is going to have my back. So just start with like 1 or 2 patients a day pulling out of it, right? And what you'll see is those patients start accepting treatment, and then it gives you some confidence. And then you start seeing those patients get healthier, and it gives you even more confidence. And just say, okay, so this week we're going to do 2 patients a day, and then next week we're doing 3 patients a day, and then we're gonna check in. So yeah, you've got to baby step back into your role in your patients. We have a huge role in our patients' overall health, and we've got to step back into that.
I agree. And I want to add to that, if that's okay, from the patient's perspective, because that's always so Rachel is dedicated, from what I see, to maintaining the hygienist perspective, even to the point where you're constantly, you know, you go into practices, you work clinical, you stay connected to what the hygienist experience is. I feel I'm a really great patient. I'm not a great patient, but I stay connected to the fearful patient's experience.
Okay, got it.
Yeah. That's my perspective.
Yeah.
And patients don't want DiGiorno at every appointment. Mm-hmm. Patients want to know that they're getting the full picture.
Yeah.
And as much as they may not always say, thank you for diagnosing me with periodontal disease, when they actually digest that kind of, we'll say, unfortunate news or circumstances, they're actually going to be grateful for the fact that they got truth from you and that they were able to improve their health because of you. And whether they show that gratitude or not, as a patient, I want to know. I want to know head to toe what's going on with my health.
Yeah. And so here's the thing that I feel really strongly about that has to happen before we can ever communicate that to our patients is the dental team, starting with the dentist, clinical leader have to believe and be committed to the fact that treating active infection, whether it is a tooth that's infected or it's periodontal disease, treating active infection and screening for oral cancer absolutely save lives and prevent major health events for our patients, right?
100%.
And it doesn't have to be done in a hypey way. It has to be done in a very authentic way. And in order for that to be authentic, we have to believe that, right? So once we can also reconnect with that and say, hey guys, I noticed that maybe we're not doing as thorough of a head and neck and intraoral exam. You know, I mean, when I did hygiene a week or two ago, I had 2 patients that had some unusual soft tissue lesion in their mouth. And one came from palpating the floor of the mouth and the other came from really pulling the tongue out. It was way at the back of the tongue, right? So I don't know the results of that yet. But that's in one day, right? So I also believe that so we take the action and then that action in itself pulls us out of the tunnel, because then we're seeing our value is way more than cleaning teeth, right?
Yep.
Our value is screening and uncovering these what could be major health issues.
Right now as a patient, I'm going, I want Rachel as my hygienist. Like, that is the strongest marketing you can do for your practice too, is to provide the highest level of care and preventive care and thorough examinations for patients.
Yeah.
So if you're struggling there, you know, you may think that the patient's inconvenienced by that exam or they're uncomfortable, but really what's going on in most healthy people's head is, wow, they actually care about me.
Yep.
I've never had another, hygienist be this thorough and concerned. Mm-hmm. So let's not project our fears onto our patients, and let's not pretend that we know their mindset, because we don't.
And here's the thing too, is, that day was not easy. And I am not going to say that I stayed on time all day, because I did not. And I'm not going to say, it had been a bit since I had been in there and I had to get the hang of the x-ray system and all of that. And there were definitely some struggles. And as a hygienist, there are some things that I am super committed to, above and beyond scaling. And patients do appreciate it, and the dentists appreciate it. And I still feel like I can be very productive, because absolutely, we still have to, we still have to look at all the facets of the practice. But so I think that's it, Grace. I think it is leading the team to really reactivate that piece of ourselves that is patient focused and that is whole health focused. And it's tough for team members so it's tough for dentists that are there and their team's not. And it's tough for the teams that when the team is there and the dentist is not. Mm. So that's where it comes to those core values and calibration of the team. And we have to be on the same page. Yeah.
Awesome. Mm-hmm. So I think we talked about this a little bit. Why is now a great time to refine and elevate hygiene protocols?
Well, the other piece of that too is that many practices still, although it's getting better, because I think our key opinion leaders and presenters and things like that in our industry are putting out a lot of content about the scheduling gap, right, for the fall. I know you guys are paying attention to that with your clients as well. But here's the silver lining of that is, if in the past you haven't been able to put in place, thorough diagnostics and a perio program in your hygiene department, if you didn't do that because you didn't have time for those patients to get back in, now's the time to reset your schedule. So now's the time to put those perio blocks in place, because your schedule's not completely packed in October. And then take that out, figure out how to make that part of your schedule going forward into 2021, and then figure out how to diagnose into those perio blocks, right? So it's a good time to reset that a bit.
Not now, when? Right?
Well, that's the question. Yeah.
Yeah. If not now, when? And we always have a reason for why we're going to do something tomorrow.
Mhm.
and why we're going to start working out tomorrow, and why we're going to start eating healthy tomorrow, and why we're going to, you know, have more focus on our business systems
Yeah.
tomorrow. But if not now, when? So take those little steps. And if it's overwhelming to you, there are resources for you.
Absolutely.
So, and Rachel and the Inspired Hygiene team is a great resource for you. What do you see as the next evolution of dental hygiene in healthcare?
Um, I think that we've been preaching at Inspired Hygiene for years that it's our responsibility to step into our role as true healthcare providers. I think it's time for dentists and the entire dental team to really open our minds to like what next, what is there next for us, and how can we serve our communities at a much higher level. So I think that while there are certainly some practices that have absolutely already incorporated things like chairside blood testing and pathogen testing, salivary testing, and things like that, it's absolutely there. I think it's time for this to become much more mainstream because, our best defense against COVID or any other virus is a healthy immune system, right? And most of our patients, it was a pleasant, not a surprise, but a pleasant confirmation how patients started coming back to the dentist, right? And feeling good about being at the dentist. And so I think we have an opportunity to elevate and expand our role into other avenues where we're really looking at our patients' overall health, whether that is nutritional counseling, chairside testing, whatever that may be. And my plan is for Inspired Hygiene to be, leading the way in that in the next few years. So I think there's some good stuff ahead of us.
I love it.
Yeah.
And, for those of you listening, that I own Identity Dental Marketing, and some of my business focus is on marketing, and a big piece of that is education. How do you educate your community?
Mm-hmm.
How do you lead your community? If you don't take the role and the responsibility of educating your community on the importance of oral health care, who's going to?
Right.
Who will? You are the most qualified person to lead your community on the importance of oral health care. So if you ever need any help with getting your message out and your education out, I'm here for you, and Rachel is here for you as well. So Rachel, tell me a little bit about where you would start with someone who needs a little help with this,
Mm-hmm.
and how they can get in touch with you.
Yeah, so typically we start by doing a hygiene analysis. So it allows us to really look at what's happened in the hygiene department, let's say over the last year to 2 years, as far as service mix. We look at profitability, compensation models, things like that as well. We look at the schedule. Is your schedule setting you and your team up for success? And then we really also look at, how is hygiene being empowered to help the patients move into care, whether that's, periodontal care, restorative care, or whatever type of reconstructive care that you're offering in your practice. So we really like to start with that a bit of analysis first, and also really have some time to chat with the team and the hygienist to find out, like, where is their mindset, and what are they excited about going forward with, and how can we not only be there as a coach to help the business owner grow this part of the business, but also to be an advocate for the hygienist as well, to help them feel their greater role in the practice and feel rewarded and excited about that. So the hygiene analysis is often where we start. And anybody can reach out to us at clients@inspiredhygiene.com. And, one of us would be happy to talk, with the practice owner and just see how we might be able to help. And, as you were talking about educating the community, Grace, you guys are so great with just promoting content for practices and videos and things like that. And man, having your hygienist do videos for your practice right now on the safety precautions that you have in place, how overall health is affected by oral health, like that's gonna really make a big impact in your community. And I really encourage everybody to do that.
Absolutely.
Yeah.
I don't know if I ever told you this, Rachel, but we actually have a program around how to create your own videos and
Love it.
how to get comfortable with that, even down
Love
to like what camera to buy and
Yeah.
all the,
That's awesome.
all the things that hold people back from getting out there.
Yeah.
So
I love that.
So if you're thinking about ways to strengthen your team right now to make a very strong comeback from this COVID crisis, I highly recommend getting in touch with the Inspired Hygiene team. Again, if not now, when? And they are there to support you. So start with that analysis. It's not going to be overwhelming. That's why you have experts and advisors in the field to support you. So Rachel, thank you so much for being here with us today. And to our audience, thank you so much for joining in, for following. Join our Facebook group, Dentistry is Growing with Grace, and please share this content with your friends. It'll help more people. Have a great day.
Grace.
Thank you, Rachel.